Imagine this, you wake up, shuffle to the mirror, and there it is, the one annoying dark hair on your chin, or maybe your upper lip, maybe even two, and your brain goes, wait, what? Why is that there? What's happening to me? Take a deep breath, I got you. Today we're going to figure out what causes facial hair to show up where you don't want it, and most importantly, what you can actually do about it, at home, in the clinic, with or without fancy treatments. And we're going to talk like friends, honest, open, with a little humor, because why not? If you're tired of sneakily tweezing in the car mirror, dodging close-up selfies, or googling late at night, why am I getting chin hair? This video is for you. We're going to talk about hormones, hair removal options, and how to stop blaming yourself. So first things first, yes, every woman has facial hair, even those picture-perfect celebrities. Most of the time it's soft, light fuzz called vellus hair, also lovingly known as peach fuzz. Totally normal. But sometimes the peach fuzz transforms. It turns darker, thicker, and shows up in places like the chin, upper lip, chest, or belly. That's called terminal hair, and when it appears in what we call a male pattern, we use the term hirsutism. Sounds intense, but we're gonna break it down together. So how do you know if it's something to worry about? Vellus hair is thin, soft, and nearly invisible, but terminal hair, it's coarser, pigmented, and shows up where women typically don't grow thick hair. And if it starts coming in with other symptoms, like acne, irregular periods, weight changes, it might be a signal that your body is asking for attention. Alright, let's get into what's causing it. First, hormones are being dramatic. Yeah, women have androgens like testosterone too, just in smaller doses. But sometimes they spike or become unbalanced. And when that happens, say hello to your surprise chin hair. The number one culprit, PCOS, polycystic ovary syndrome. Your cycle's all over the place, maybe some breakouts, and suddenly you're reaching for tweezers more often. Been there. Or maybe it's menopause, when estrogen drops and androgens have more of a say. Result? The little mustache you never signed up for. And sometimes it's the meds. Things like testosterone therapy or minoxidil, used for hair growth, can backfire, giving you hair in all the wrong places. Second, genetics. If your mom, aunt, or grandma had it, chances are you might too. Especially if your roots are Mediterranean, Middle Eastern, or South Asian, it's more common and completely normal in those populations. Third, medications. Certain drugs like phenytoin, corticosteroids, or again minoxidil can cause hair growth where you least expect it. Fourth, rare but real causes. If facial hair appears suddenly and aggressively, and you also notice a deeper voice or other unusual changes, please talk to a doctor. It's rare, but it could be a sign of something deeper going on, like an adrenal issue or a tumor. Wondering what to do next? Here's how to start figuring it out. Ask your doctor for blood tests, testosterone, DHEAS, insulin, and a full hormone panel. Use the Ferriman Gallwey scale. It's how doctors rate body hair growth in 9 areas. Pro tip: how to prep for your doctor's visit. Write down when the hair started and how it's changed. Track any cycle changes, new acne, or weight shifts. Snap a few photos. They're super helpful for comparison. And most importantly, don't be shy. Say, I'm getting facial hair and I want to know why. You deserve answers. Quick guide. What's the Ferriman Gallwey scale? It's a system doctors use to rate how much hair you have in places like your lip, chin, chest, back, belly, and thighs. Each area gets a score from 0, none to 4, thick and coarse. A total score over 7 or 8, that's when they might call it hirsutism. You can try this at home. Just look in the mirror and give yourself a rough score. It's not a diagnosis, but it's a great way to get perspective and track progress. Okay, now let's talk about what you can actually do, starting at home. Step 1. Get rid of the hair that's already there. Shaving? It's okay, but you should be aware of the fact that if you have hormonal disbalance, shaving can make your hair look thicker. Shaving can also cause irritation because of its exfoliating effect. Waxing, tweezing, sugaring, if your skin can handle it, go for it. Depilatory creams like Nair work, but always do a patch test first. Dermaplaning? Oh yes, let's talk about the gel. It's a super popular method right now, and for good reason. It's basically when you use a special blade, yes, like a tiny scalpel, to gently remove the top layer of the dead skin cells along with any peach fuzz on your face. Sound intense? I get it, but it's actually really gentle and safe when done properly. You can do it at home with a disposable blade or get it done professionally at a clinic. Makeup looks wonderful on skin after this procedure. It applies like a dream. But let's be real, it's not for everyone. I don't recommend dermaplaning if you have rosacea or broken capillaries. It can make redness and visible veins worse. Same goes if your skin is super dry, dehydrated, or flaky. It might be too harsh and cause tiny micro injuries. And aftercare is a must. Always apply SPF type to dermaplaning. Your fresh, baby soft skin will be more sensitive to the sun, and we don't want pigmentation sneaking in. Bonus tips for home skincare. Use enzyme pills once or twice a week to gently exfoliate. Hydrate with serums or creams that include niacinamide or ceramides. Skip waxing if your skin is irritated or flaky. It just makes things worse. Step number 2, slow down the hair growth. Apply cream with eflornithine twice a day, and it can really help with the hair growth. Try cream twice a day. It takes 2 to 3 months, but it works. Best results come when you combine it with any hair removal method. First remove the hair, then apply cream so new hairs will grow slower and softer. Step number 3, treat the root cause. If you have PCOS or a confirmed hormone disbalance, birth control pills, the combo kind, help balance hormones and slow down hair growth. Spironolactone blocks androgen effects. Sometimes metformin may be prescribed if insulin resistance is part of the picture, but important, always do this under a doctor's care. Step number 4, when it got for good, let's talk long term. As in, no more plugging, no more guessing, just smooth skin for the foreseeable future. Laser hair removal is the go-to option here. It's modern, powerful, and if you stick with the full course of treatments, the results can be close to permanent. You'll likely need a few touch-up sessions once or twice a year, but that's way easier than a weekly date with your tweezers. It works best on dark hair since the laser targets pigment, but that does not mean it's off limits for blondes or redheads. Just know you might need more sessions. And a quick reminder, if you're planning to get lasered, stay out of the sun for at least 2 weeks before your appointment. No tanning, and don't tweeze or wax, shaving only please. Now if you're dealing with a hormone issue, here's a hot tip. Pair your laser treatments with hormone therapy. That way, you're treating the root and the surface, and your smooth skin results are more likely to last. Electrolysis is another option, but it's amazing for any hair color, even white or gray. Is it a bit more uncomfortable? Yep. Is it slow? Also yes. But is it effective? Absolutely. If you're patient and consistent, it can lead to permanent results. It's especially good for small, stubborn areas, like that one on chin hair that refuses to mind its business. Can you prevent new hairs from popping up? Totally, but it takes a combo of care. Keep hormones steady with ongoing treatment. Keep your weight stable, even small changes help with that. Eat more fiber, protein, and whole foods. Cut back on sugar and high glycemic carbs. Move your body. Exercise supports metabolism and balances hormones. Get enough sleep and reduce stress. Your hormones will thank you. What not to do? Seriously, don't take hormones just because someone online said they worked for them. Don't tweeze obsessively. it can cause ingrowns and dark spots. Don't use bleach or harsh chemicals on your face. It's not worth it. And don't be embarrassed to ask for help. You're not alone, and this is 100% valid. Let's talk myths and truths. Myth: plucking causes more hair and ingrown hairs. Truth: if you pluck carefully, you're fine. But yes, plucking too often or without care can lead to irritation or ingrowns. Myth: I'm the only one dealing with this. Truth: no way. There are thousands, actually millions of women going through the same thing. You are absolutely not alone. It can still be hirsutism, especially if it's on your chin or upper lip. It's a good idea to get your hormones checked now instead of waiting for more to show up. Yes, stick to safe, gentle methods like shaving, dermaplaning, or tweezing. No lasers or harsh chemicals. Nope, it might feel thicker when it grows back, but it's not. Pinky swear. Final thoughts. Friend to friend, you did not cause this. You're not weird. You're not alone. Your body is just asking for a little extra attention. And if any doctor tells you to just shave and stop worrying, find a new doctor. Now you know why this happens, what you can do about it, and what you're seriously not alone. If this helped, give it a thumbs up and send it to someone who needs it. Subscribe if you want more no-nonsense, science-backed, girlfriend-level health advice. You are beautiful. Facial hair does not define you. See you in the next video.